What if 5 simple vitamins could help you lower your blood sugar? What if fixing diabetes-related nerve pain, heart issues, low libido, kidney damage, and dementia was far easier than you imagined, all with the help of these 5 vitamins? Eager to learn about them? First, it's vitamin D, or what we know as the sunshine vitamin. And trust me, this one vitamin can be your go-to choice for managing your diabetes. But before we get into how sunshine vitamins can be your lifesaver, here's the shocker. Even in sun-soaked regions like the Middle East and North Africa, vitamin D deficiency is still common. That's because people are spending more time indoors, or they're covering up their bodies for cultural or religious reasons. This is why they miss nature's dose of this vitamin from their diet. But if you can manage to make up for this deficiency, this vitamin can be a total force of nature for managing your diabetes and even prevent the progression if you're pre-diabetic. You might know that vitamin D helps make your bones strong by playing its role in calcium synthesis. That's just one benefit of vitamin D. It also activates receptors on the insulin-producing beta cells in your pancreas to push them to do their job better. Yep, it's like improving insulin sensitivity in your muscles and fat cells. So, what happens? Your body becomes more responsive to insulin, helping you manage blood sugar more effectively. But wait, these are not mere claims. Research backs this up. A 2024 meta-analysis published in Diabetes, Obesity, and Metabolism looked into studies that dealt with almost 3,000 people with type 2 diabetes. This meta-analysis's findings revealed that vitamin D supplementation could significantly lower fasting glucose levels, HbA1c, meaning long-haul blood glucose levels, insulin levels, and HOMA-IR, which is a key marker of insulin resistance. And these positive effects of vitamin D supplementation effects were more pronounced in people who are already deficient, overweight, or had high blood sugar. But how much vitamin D can be helpful? Look at the findings of 2017 meta-analysis published in the Journal of Clinical Endocrinology and Metabolism. According to this research, a minimum daily dose of 4,000 IU or 100 microgram of vitamin D could greatly reduce fasting plasma glucose, HbA1c, and insulin resistance in type 2 diabetics. So, does vitamin D help with the management of diabetes? No, it works great for prevention too. Scientists have found that vitamin D supplementation can reduce the risk of full-blown diabetes in pre-diabetic individuals by 15% reduced risk of progressing to full-blown diabetes. Not only this, but more impressively, it increased the chances of returning to normal blood sugar levels by 30%, especially in people who are not obese. That said, the vitamin D trend is promising and has great potential to help you manage your diabetes. Soaked up the sunshine with vitamin D or ingest it with pills to beat your type 2 diabetes? Let's talk about another must-have vitamin that your body begs for to manage its blood sugar levels, especially if you've been taking metformin. It's vitamin B12, the guard for your nerves. This B vitamin plays a major role in keeping your nerves healthy. And for people with diabetes, nerve damage, also known as diabetic neuropathy, is pretty common. This condition results in pain, numbness, burning feet, tingling hands, and even serious complications like ulcers, which may lead to limb amputations. A 2022 meta-analysis published in Curious found that vitamin B12 supplementation could significantly reduce nerve pain and neuropathy symptoms in diabetics, and that's huge. But how much B12 can you take? A 2021 nutrient study shows that patients who took 1,000 micrograms of B12 daily for a complete year observed noticeable improvements in their nerve function. Their pain scores reduced, and even their quality of life got better. Meanwhile, those who didn't use B12 supplement, their nerve function actually got worse over time. Here's a kicker: metformin, your blood sugar lowering drug, actually blocks B12 absorption in your body over time. That's how the very drug that controls diabetes also silently wrecks your B12 levels and increases your risk of nerve damage. That's why the American Diabetes Association recommends checking your B12 every year if you're on metformin and supplementing when needed. Amazed how vitamin B12 works like a magic wand for your nerves' health? Let's shift gears to another vitamin that your body craves daily: vitamin C from citrus and guava. This antioxidant vitamin is greatly helpful for controlling your blood sugar. You must have been introduced to vitamin C as an immunity booster that helps you fight colds, but its role in diabetes has been underrated. Aging, just like previous deficiencies of vitamin D and B12, vitamin C deficiency is also pretty common in people dealing with type 2 diabetes. Are you wondering why? The reason is that high blood sugar is what we know as hyperglycemia. It actually blocks vitamin C from entering your cells. Don't feel sad. Here is some good news. A 2023 meta-analysis published by Diabetes and Metabolic Syndrome revealed that high-dose vitamin C supplementation of 1,000 milligrams a day for at least 12 weeks lowered HbA1c, fasting insulin, and fasting blood glucose in people with type 2 diabetes. That's a triple win for blood sugar control. Are you thinking about boosting your vitamin C intake? Wait, we're going to convince you even more. A study published in Diabetes Care last 2021 shows that vitamin C as your frontline antioxidant may also reduce oxidative stress in the body, the damage caused by long-term higher glucose blood spikes and other harmful compounds. By reducing oxidative stress, it improves cardiovascular health besides offering glycemic control, two major concerns in diabetes. Above all, the benefits of taking vitamin C supplements for a longer term are even more promising. After getting you the protection of vitamin C against oxidative stress and blood sugar spikes, we've got another key vitamin for your alliance. Vitamin B1, also known as thiamine, is the activator of carbohydrate metabolism. Coming from whole grains, meat, fish, and legumes, it acts as a cofactor for key enzymes like transketolase and pyruvate dehydrogenase. These enzymes are like biochemical machinery that keeps your cells running. The real catch? People with both type 1 and type 2 diabetes often lack thiamine, leading to a higher risk of heart problems. Curious to know the reason? It's high blood sugar that increases thiamine loss through urine before your body can use it, and that's a big problem. A 2025 study published in the International Journal of Molecular Sciences shows that thiamine can lower blood vessels inflammation, a root cause of heart disease. Not only this, it also minimizes protein glycation, which is like turning your protein into garbage that further harms your body. It happens when glucose molecules attach to protein molecules directly, leading to an increased number of glycated proteins, which at an advanced level become advanced glycation end products or AGEs. This next level of damage leads to oxidative stress, artery damage, and heart complications. You think thiamine is just wonderful for the heart? Here is the most amazing thing that every diabetic must know about it. Studies also show that thiamine supplementation may improve blood glucose levels consistently, also known as HbA1c and fasting glucose levels. A 2023 review from Helion also highlighted benfotiamine, a lab-made form of thiamine that may ease diabetes-related nerve pain and prevent long-term nerve damage from high glucose levels. Bottom line, vitamin B1 is a critical nutrient that could help slow or prevent diabetes complications before they take root. Now that you've learned the power of vitamin B1 for protecting your heart and nerves, let's move to another B vitamin that's just as crucial but often overlooked. Meet folate, also known as vitamin B9, the guardian of your blood vessels, genes, and insulin response. Folate plays a behind-the-scenes role in DNA repair, amino acid metabolism, and methylation, but its real magic in diabetes lies in its ability to impact blood sugar regulation and cardiovascular risk. A large-scale meta-analysis of 18 trials involving over 21,000 participants from Science Direct found that folate supplementation significantly reduced fasting glucose, insulin levels, and insulin resistance. While it didn't have a strong effect on HbA1c or diabetes incidence, the reductions in glucose and insulin metrics were still clinically meaningful. Want more proof? A 2022 randomized controlled trial published in Nutrition and Diabetes found that just 3 months of folic acid supplementation led to impressive results. Fasting glucose dropped by 8.7%, HbA1c fell by 8.2%, serum insulin dropped 13.7%, and insulin resistance decreased by a striking 21.7% compared to the placebo group. But folate's story doesn't end with sugar. It also effectively deals with homocysteine, a compound linked to heart disease and often elevated in people with diabetes. Folate helps break down homocysteine, the amino acid that can cause inflammation in blood cells. Furthermore, it improves blood vessel cell lining function and reduces oxidative stress, a game changer in preventing diabetic-related heart complications. Even more compelling, a 30-year follow-up study published in diabetes journals revealed that higher folate intake in young adulthood was linked to lower diabetes incidence in midlife. So, folate may not grab headlines, it's quietly protecting your blood vessels, fine-tuning insulin response, and possibly helping you avoid diabetes altogether.